Professor Jefford, tell us a little bit about your role and where you work.
So I'm a medical oncologist at Peter MacCallum Cancer Centre in Melbourne. And at Peter Mac, I'm also the director of the Australian Cancer Survivorship Centre, and I'm a health service researcher.
Great. So, being a survivorship expert, I do want to ask you several questions. We know that there are now 64 million cancer survivors across China. Now, these people are cured from the cancer, isn't it? So why do they need more care?
Good question. And look, the good news is that, of course, many more people are surviving cancer now because of improved detection, better treatments, better supportive care, which is terrific. But of course, the particularly over the last couple of decades, there's been much more recognition that when cancer treatment is completed, people can still have residual and lasting problems that can affect them for the rest of their life. It could be physical issues like pain and fatigue. It could be psychological issues like distress or worry about cancer coming back, and really practical issues like difficulty getting back to work, loss of income. And at the moment, the healthcare system doesn't have enough focus on all of these aspects. So great that we have more survivors, but we still need to. It's not over when the treatment's complete.
Now, I know that in Australian Cancer Survivorship Centre, which you lead, is very strong and has a mission in educating and preparing professionals who can
Yep.
provide that care better.
Yep.
Um, we know that there are probably over a million or millions of cancer care providers. And in CACA, the China Anti-Cancer Association alone, they have got over 800,000 members. If we can actually offer training to them, what do you think could be the potential benefits to the 64 million cancer survivors that we know?
Yeah, so one of the issues around survivorship care is that we don't necessarily, and a lot of clinicians haven't been trained in survivorship. And so for a lot of people, it is quite new. And we talk to people about the issues that survivors experience, and a lot of health professionals, it's something new for them. And so we do really need to build awareness and have more education and training. And in Australia, we've developed some online training that's free, reasonably short and applicable to a variety of health professionals. And so, what we'd like to do is to be able to translate that to other languages. And so, the ability to translate this for people who speak Chinese in different areas of the world, China and beyond, then that gets to a large number of people who can help survivors. So, I think there's an enormous opportunity.
Yeah, absolutely. You're absolutely right. Within the Bridge program, which I know the Flinders University, together with our partners, are trying to develop a fellowship program
Yeah.
that would enable us to bring 24 oncologists or young nurses or clinical leaders to be able to come to Australia to do some shadowing
Yeah.
at our centers of excellence and do some research projects together with us.
Yeah.
What do you think could be the potential benefits of that? Because there are millions of providers. We are only being able to take 24. These are leaders, and I'm
Yeah.
interested in knowing what you think the potential benefits may be of such a program.
Yeah. So I think there's a lot of potential benefits. And we think about, people who might do a fellowship and learn a new surgical technique. And so you might think of that as, okay, well, you're just learning that, but you're taking it home, you're sharing it with everybody at home. And often we think of these as being unidirectional, but it's not unidirectional learning. And what we're trying to do is to, with Bridge, to have something that is truly bidirectional. And so, yes, we've got people from China coming to Australia and elsewhere, but the amount of opportunity that gives for us in Australia to learn about how things are done in different settings. And, we're at a conference at the moment, and one of the main learnings there is hearing how people do things in different settings, what works in their setting, and what we can bring home. And I think there's a lot of opportunity from the fellowship program for it to be bidirectional and that it will have legacy. And so it's not just about the period of the fellowship, but it would be long lasting connections, networks, skill building, and something that would be sustained and perpetuated.
Absolutely. Thank you so much for spending this time with us today, and I'm sure that would help our colleagues. understand what bridge can potentially do for the millions of cancer survivors, but also similarly how they can benefit Australia in a
Absolutely.
bilateral way. Thank you so much.
Thank you.